19 minutes after 8 o'clock, and today on Lifestyle we look at our health, and specifically we're looking at heart disease. And with statistics showing from 18 years and below, we have 200,000 people or children that suffer heart diseases in this country. So it's a conversation that we must have, not only because of the heart run that's coming up, but because it is important. And out of those, 50% of the 200,000 are congenital, or in simple terms, these are heart diseases of children who they're born with these heart diseases. The other 50% develop as you grow. So it's a conversation that we must have, because heart diseases, I'm sure you do know, are very, very, very serious diseases if not taken care of. Now, joining me in the studio this morning is Dr. Naomi Gashara, who is a pediatric cardiologist. Thank you for joining us, Dr. Gashara. We also have Dr. Agnes Chege, who is the acting CEO, Mater Hospital. Thank you for coming. And I'll start with you, Dr. Gashara, and the question would be, we're looking at these statistics. They're fairly high, given that 50% especially are congenital. Maybe you could just start by defining for us some of the common heart diseases that children suffer from.
Okay, let me start by saying that in statistics, every 1 in 8,000 children born has a heart problem.
1 in 8,000.
That is congenital heart disease, leave alone acquired. So in those 1 in 8,000, we may have simple heart diseases. Of course, is never simple to a mother, and we have complicated. The kind of heart diseases we have are holes, what most common parents would say.
Hole in the heart.
Hole in the heart. Most of them will have holes, simple, straightforward holes, but holes that have maybe one or more things in the same heart. So, in the same heart diseases, you can have those who are not blue and blue babies. Okay,
what's a blue baby?
A blue baby is a baby whose color is not like yours and mine. It's actually looking blue.
And this is at the point of birth?
It's at the point of birth. Some are actually quite blue at point of birth. Others, it progresses. It may not be significant at the time they are born. But as they grow 6 months and over, they start being blue. Others, like squatting, it's not a very common finding for any one of us to squat, but those babies can squat for a long time.
When you say squat, what do you mean? Do you literally mean squat like
literally mean
for
squatting.
A baby who's just been born?
No, for a little bigger baby.
Older.
Yeah.
Okay.
Yeah. Then yeah, most congenitals will actually involve that. Blue babies, not blue.
Okay. Now let's talk about the hole in the heart, because I think this is one of the most common congenital heart diseases. What exactly is a hole in the heart?
A hole in the heart is a gap, whereby, if you remember, if I go back to little biology, we were told about 4 hearts, 4 chambers. 4 chambers, yes. And each, the right side and the left side, have a wall that divides, such that the blood from the right side should not mix with blood from the left side. So when you have a hole, you actually have a communication. So a hole is a communication between the chambers of the heart.
All right, and I'll come to you, Dr. Agnes Chege, in just a short while. But still on the hole in the heart, is this something that develops while the child is in the womb, or is it something that you know is there after birth?
No, when the heart is developing, long before we even know we are pregnant, it develops quite early. Then the walls of the heart are supposed to also grow, but it reaches a point where the growth arrests. So if it arrests, it creates a gap. That's the hole. So they are born with this hole. This hole does not get bigger, but it can get smaller in some of the holes.
Okay.
Others may remain just the same size.
All right, Dr. Chege, let's talk a little bit about the heart run, and first of all, let's go to the history. What made it necessary for Mater to come up with this initiative?
I'll say that in the 1990s, there was very little work which was being done on cardiac ailments. So the Mater Heart Run decided that they'll go into this specialty of cardiology, so that they could be able to supplement what was also going on from the government side. So that's how we started our heart program in 19 96.
Okay.
Yes.
Okay, and I'll take this opportunity just to let you know what we're talking about here, and also to welcome you. Should you have any questions, comments, anything you'd like to find out from the Daktaris who are in the studio today, feel free to do so. You can call, or you can also tweet at Michael G. Gitonga. And I'll come to you, Dr. Gashara. And still on the hole in the heart, is this something that's hereditary?
There are some of the heart diseases that learn within families. Yes, not a big percentage, but it has happened. But it doesn't mean that if I have a child with a heart problem today, tomorrow I'll get one with. But there's a higher chance than a mother whose babies have never had heart problem. Yes.
Okay, and is there a way of one telling that the child, as they're developing, because I'm sure there are those stages that you know the mother goes through and the child goes through while they're still in the stomach, is there a way of telling that this child has a hole in the heart before we get to, you know, the cure?
While still not born, with the scanning that they go for, the ultrasound, let me say in developed countries they are able to actually see the heart, scan it, and tell the mother there is a hole. It's also happening here. It may not be quite well developed, but you can actually tell there's a problem with the heart still in utero or before birth.
Okay, and then let's come now to some of the how to, you know, have this cured.
How to get cured is actually when we see as cardiologists, we advise on which heart needs surgery immediately, or the definitive treatment in most of them is fixing the problem, which can be in two ways, either through surgery or otherwise. Where otherwise I mean there are interventional cardiology, where you put devices to close. That's what has been happening over the weekend in Mata. About 30 of them were done. Closure, not going through a scar, but through a pinhole.
Okay. Dr. Chege, what are some of the other heart diseases that children, you know, suffer from?
We do, apart from what Daktari has said here, the congenital heart diseases, which you get from birth, we also get acquired heart diseases. Now, acquired heart diseases, you're not born with that. And you find that the vulnerable age is between 5 to 15 years. And it comes from a simple sore throat. You'd be surprised. And a child can go to school and just get fevers, onset, sudden onset of fevers, and pain in the throat. And if you don't take care of that, you'll find that after a while, that child will start getting joint pains. And it starts affecting the heart. You find swollen legs. So it's very important when a child comes home to the mother and complaining of fever, for you to take them.
So what you're saying is that this one is developed from just a simple cold, sore throat.
Yes, a sore throat. But we need to differentiate between viral and this one, which will develop into rheumatic heart disease. Okay,
so what's the difference?
The difference is, if it's a viral infection, probably the child will complain they're having ringing in the ears, itching the ears, and probably feel that they need to clear their throat. Eventually, yes, it could lead to a fever. But when you look at the rheumatic heart disease, the rheumatic sore throat, that is going to be developed from a bacteria, streptococci. And it is very sudden, the onset. The fevers will come on, the throat will be very, very painful. And if we don't take care of it at that particular moment, it now proceeds.
Okay. Yeah. Dr. Gashara, this would sound very alarming to a parent, that just a sore throat could cause heart disease. But is there a progression? And what's the difference between that child who develops the heart disease and the one who possibly does not, with the same sore throat?
Okay, just like she was saying, most of the sore throats, not to scare mothers, actually come from viral infection. And in a viral infection, there'll be running nose, child wants to itch the ears, clear the throat, and is moving around. While else for this streptococcal sore throat that is actually the one that complicates into a heart problem. The child may be well, goes to school, you are suddenly called by the teacher, your child is very sick. Sudden fevers, can't swallow, and is actually sick. So we're talking of a child who was probably not telling you or not having all those other symptoms of running nose and the like. And when you take this child to hospital, the throat is looking quite bad. So that's the one we want the mother, all the guardian to actually take precaution.
Okay.
Because when it is not well treated, it complicates. In about 2 weeks later, this child will have very severe joint pains, have fevers. And
So the time span is about 2 weeks.
it's about 2 weeks.
Between
10
the
to 2
time they
weeks.
get the sore throat
Yes.
and when they actually now begin to show symptoms.
Yes.
Okay.
Unfortunately, for us, when you have joint pains, you start thinking about other things like
In fact, most people say
and
malaria.
Exactly.
Yeah.
So it's missed on. And that same child can get another sore throat through the same process. So, and each time they get that, the heart is affected. We actually say it reaches the joints because the joints are left with no complication, but bites the heart. Where biting the heart is damaging the valve. So they later present with leg swelling. They get so tired, they waste away, they think, they tell you the heart is beating, and actually see the heart pumping out of the chest.
Wow. Okay, Dr. Chege, is there an age limit to which now this rheumatic heart disease the child develops, or is this now something that we worry about until the age of 18? Is there like an age limit to which the risk is higher?
Yes, that's why earlier on I said that they are vulnerable between the age of 5 and 15. Now, after the age of 15, remember now they are growing into young adults.
Correct.
Whereby also, in as much as we are talking about pediatric diseases, the young adults can also get these heart problems.
Okay.
Yes.
All right, that's now rheumatic heart disease, I believe. That's what it's
That's
called.
rheumatic heart disease.
Okay, now is there a way of differentiating for the parents' sake, especially so that you know which one to act on urgently? Is there a way of differentiating now between the viral and the other virus that you, I mean the bacterial that you talked about, so that you can tell this is high risk and this is, you know, one that I can treat with just you know, what do we call it, ile tunaita dawa. There is lemon, ginger, honey, and, you know, give it to the child.
This is where I said, for viral, we'll start with makamasi, when we see that.
Okay.
Running nose, sneezing, all the time clearing the throat, and you see the baby putting their finger in the ear because you feel itchy. But they're still learning and doing their own things. They may again get some fever. While else, for the streptococcal, it's a child who probably was well, so you thought, and you're called by the school. This child is quite sick, has fevers, cannot swallow, it's quite painful.
Okay. We have Anissa from Garissa. Anissa, thank you for calling. Okay, Anissa? Maybe that call has been dropped. All right, that call has been dropped. Just a reminder that if you have a question for our doctors, we have Dr. Naomi Gashara, who's a pediatric cardiologist. We also have Dr. Agnes Chege, who's acting CEO for Mater Hospital. And today we're talking about heart diseases in children. Feel free to call if you have a question or comment that you'd like to participate in this particular conversation. We're talking about now identifying the different kinds of colds or sore throats that would you know, put a child or make them vulnerable. And Dr. Chege, there are those children who may not be able to communicate with you to tell you that they are not feeling well, and their running nose may not be that open. Is there another way that a parent can identify that their child is having this particular kind of sore throat?
Well, I'll take a little child, the one who is breastfeeding.
Correct.
Remember, if they get that sore throat, in as much as they're not able to communicate to you, maybe the child is 9 months or 1 year or something, and you're trying to breastfeed this child, and the child is not breastfeeding, and they're crying, and they're really, really crying, and they've got fever. So the mother will notice that this child is not feeding, and they'll also notice that the child is got fever. When you touch the child, you will feel that the child has got a fever.
Okay.
Yeah, so that's how you would identify, in those children who are not able to communicate.
All right, Anissa is back. Anissa from Garissa, thank you for calling. Good morning.
talking to you.
Yes, Anissa, go right ahead.
Yeah, I have a question for the doctor.
Go ahead.
I have a 2-year-old baby girl.
Mm-hmm.
She's been tachycardic since birth.
She's been
tachycardic. The heart rate has been high since she was delivered.
Her heart rate has been high. So just speak a bit loudly so that I can get you.
Yeah, the heart rate has been high since delivery. 2 months ago, I took her to a pediatrician. An ECG was done. It was normal.
Okay.
The child looked blissful. 2 days ago, I treated her for tonsillitis. She's been having fevers. She's now okay, but the heart rate is still high.
Okay.
As for yesterday, at sleep, the heart rate was 140. So I'm wondering, what could it be?
Okay.
It's okay for her to have such a high heart rate at such an age?
All right.
Or could there be any other problem that I would like to know besides the ECG? Is there anything else I can do?
Okay.
Thank you.
Thank you, Anissa from Garissa. Now, she's a very detailed mother, I must say, that she says that the child is 3 years, has a high heart rate. They've done an ECG, which came out normal. The child is playful. I think yesterday or a few days ago, she had some tonsillitis. So her heart rate is at 140. So we'll come back to your answer just as you think on that. Then we have Chege in Nairobi. Good morning.
Good morning.
Yes, Chege, go right ahead.
Okay, my name is Chege. I'm calling regarding my daughter who is 11 years. And she has frequent or recurrent tonsil problems.
Recurrent tonsillitis.
Tonsils and throat problems. Even right now, I have her in the house. She experienced that problem on Saturday. Like it was Saturday night, so we were unable to take her to hospital. So we went to chemist and we bought some antibiotics. Okay. We are given a Moxil and some painkillers, that is Brufen. Painkillers for 250 ml milligrams. Yes, she has not improved, although she's not the way she was on Saturday. Okay. She went to school yesterday. And today, when she came back yesterday evening, I found her having not improved. Okay. So today, right now, she's at home. All right. But when I talked to the doctor who gave us the antibiotic, he told us because she has not taken for the antibiotics for 3 days, she has to take at least 3 days so that we can be able to see whether she's improvement. Okay. So she's still taking the drug. Today will be the right day. All right, check it. Just a quick question. My worry is it is a recurrent problem since he was young. Okay. A recurrent problem of tonsils, throat, that itching of the ears. But always, whenever she gets the problem, she's treated. She okay. We don't buy the drugs over the counter. All right. Yeah. So did you say you got a doctor that was prescribed, or you bought them off the counter? Okay, we talked to a doctor at the pharmacy, and we told her the problem, and she told us, okay, because it's at night and so we cannot be able to leave to medical center. Okay. So he gave us a Moxil and a Brufen. All right. Thank you. Thank you very much. Thank you, Chege. All right, let's start with Anissa's daughter, who's 3 years, high heart rate, ECG is okay, she's playful. She recently got tonsillitis, and her heart rate is at 140. Dr. Kashara.
She sounds like she's fit. What I would want to know is, was the ECG done when she had the fever? Because at that time you may have a high heart rate related to the fever. The fever. The tachycardia rather. So, but if the ECG is actually normal, I wouldn't be worried. But I would advise Anissa's mother to maybe have checks every 6 months, just to be assured that all is well. But if you took an ECG when one has fever, the tendency of the heart rate being high is quite high.
Okay, 140 would be...
It will be a bit high for a 3-year-old.
For a 3-year-old.
Yeah, but it is a normal ECG.
Okay.
Yeah.
This Chege's daughter, who is 11 years now and has recurrent tonsillitis, currently on amoxil as antibiotics. Dr. Chege?
Okay. It's good to hear that at least Chege has gone to seek some help for his daughter. And amoxil is a penicillin. And you'll find that from a long time ago, it's been proven that even strep infection is cured by the penicillin. So when he talks about the amoxil, it is a penicillin which does cure, the sore throat. However, that child is having a lot of recurrent. So it's important, apart from going and seeking the treatment over the counter and getting that amoxil, they also need to seek help from a doctor so that you rule out that it's this acquired rheumatic heart disease. So it's important that apart from just going and taking the penicillin, that they also do seek further advice from a doctor.
Okay, Dr. Gachara, when you have recurrent sore throats or you know, this tonsillitis, what would be a frequency that you should be worried about? Because tonsillitis is fairly common and, you know, it's fairly acquired from, you know, workplace, school. At what point does one now begin to get concerned that the frequency is above normal?
If you have a child who is out of school twice a month or so, that is high. But I would still advise Chege, what we say about sore throat, seek prompt and proper treatment. Where I mean proper, as of you need to be examined. We have no issues with pharmacy. That's where we send our patients to get medication. But the examination may not be there. Because I start over the counter and I get the drug. Yet nobody listened to my heart or even examined me.
There was no proper test done.
Yes.
Okay. Dr. Chege, what would you say, especially your background, you're a pharmacist, what would you advise parents specifically who, like now Chege, may be out of having this recurrent tonsillitis? You kind of get to know what medicine is going to be administered every single time you go. But what would your advice be to one who has gotten to a point where they already know the medicine, and rather than go to the doctor, now go to the pharmacist and just buy off the counter? After all, it seems to work.
I would advise, it's very, very important that people don't just go and seek medication over the counter. Fine, yes, the first time when they did go and they got that. But remember, this is recurring. So I would advise, don't always go to seek medication over the counter at the pharmacy, because it could be a serious issue which you're facing, and you're not going to the doctor, so you've not been tested. Just like Daktari said, there are certain tests which you need to be done. You need to be checked that throat so that you're sure what are we dealing with here, so that we're not just treating it empirically.
Okay. Let me also add to that. When we get these children who complicate from the sore throat, to prevent recurrency, we do put them on a monthly injection of penicillin. So that does prevent the recurrences. And like I had said earlier, any recurrence affects the heart further. So that is why it is important.
Avoid the recurrence.
Avoid the recurrence by seeking the proper.
Okay. We'll take a call from Jane in Nairobi. Good morning, Jane.
Good morning.
Yes, your question or comment?
Yes, my question goes to Dr. Gachara. I know her, I've seen her like 3 times. She saw my daughter who had a problem with their heart. They said she had disposition of great heart arrest. And I was advised to go to India to have a training procedure.
Okay.
So we did that late last year, November last year, and came back and she was okay. Then she started having some breathing problems. I took her to Kenyatta. Dr. Gachara saw her. I was admitted and they did an echo. They said the surgery is quite perfect, but they said the ejection fraction was 11%, which I did not understand very well. So we went back to the ward and we were given some treatment. And 5 days later, my child died.
Oh dear, sorry about that.
So I would like to understand what really caused death for my baby, because we already did surgery that was required.
All right.
Yes.
Sorry about that.
2 weeks ago.
Sorry about that, Jane. We really condole with you and pray that God will give you strength. All right, we have Evelyn in Eldoret.
Hello.
Yes, Evelyn in Eldoret. We can hear you. Go right ahead.
How are you? Good morning.
Morning to you.
I'm Evelyn. Niko na msichana 4 years.
24.
4 years.
4 years,
This year January, aligonjeka, akapata fever. I thought it was about to clear.
Okay.
I'm an nurse by profession. So when I came back in the evening, I found that the other kids told me she could not even handle even a cup. She could not even raise a cup. So nikamwadmit referral. After that, akafanyiwa hipo. They found out that was normal. But the problem is she still complains of that sore throat and the feet in a fura. And the so what could be the problem? Because I've been doing the echo, but they are saying it's normal.
Okay. All right, thank you, Evelyn. Dr. Gashara, the first question is to you from Jane, and she's gone through the history of the child who she very sadly lost, but she wants to know what could have gone wrong.
Sorry, Jane, apparently I know Jane. I'm the one who handled her child. After surgery, Jane came back with a baby whose ventricular function, the pump itself, was quite weak. And by the time she came to us, it was extremely weak. So even pumping blood through the system was quite affected. And as much as we tried, yes, the heart also fails. So I would put it in simple language, the heart failed.
Okay, it just could not handle.
Couldn't handle,
work
and
anymore.
remember it has had heart surgery. And I know Jane went in November, but I saw her, I think, in March, having come from other hospital. I think probably Jane, we need to sit.
Okay,
Yeah.
for you to explain. And I guess even for the
explain
sake of closure,
Yes.
because for her really it's just to understand what did her baby go
She
through.
needs to look for me because she knows me.
Okay. Evelyn in Eldoret was a 4-year-old who developed a fever and became weak. What might her child be going through?
She developed a fever and became weak.
She developed a fever and she says she's a nurse. So when she came home, the report was the child could not even lift a cup. So I'm imagining that she probably developed and, you know, for some reason or the other, was very weak.
It's interesting, considering the mother is also a nurse.
Right.
So maybe she needed to give us more details. Has she been getting, you know, these problems on and off, or was it just a sudden onset? For me, I felt we needed to have some more details. I don't know what Dr. Gashara would say.
Well, it's unlikely that the cardiac problem will give you that weakness. And since you went to hospital, this is a child who needed more examination, further history. That one system, I mean statement, I'm not sure we can
qualify
really
that it's a heart issue.
No.
Okay. She would need further investigation and maybe more details for you to come up with a proper prognosis. All right, we'll take a call from Margaret in Kajiado. Good morning, Margaret.
Hello.
Yes, good morning.
My question is, niko na shida ya kuumwa na kichwa side moja.
Ati uko na shida?
Kuumwa na side ya moja.
Sorry, Margaret, sikupati. Unaumwa na?
Kichwa side moja.
Figo.
Kichwa.
Oh, kichwa. Okay.
Na tunasikia kuna kitu vile na ya difficulty. Alafu mguu na mkono kama imeganda vile kipati.
Okay.
Yeah.
All right, so asante sana, Margaret. Dr. Gashara, I'm not sure if you got that question very clearly, but she has a headache on one side. Then she says she also feels weak on one side. Could that be an indication of a heart?
How old is she?
She's definitely not a child. But does age matter? Would that be an indication of a heart challenge?
It would, although there probably be more history than just a headache and weakness of one side. But what I will tell her is, can she seek medical attention where history is well taken, examination is taken, then we'll be able to tell.
Okay. Dr. Chege, I'm going to come to you and we'll look at the MATTR Heart Run and some of the details on it. But before we go there, are there some other children's heart diseases that we've not talked about? We've talked about the rheumatic heart disease. We've also talked about the hole in the heart. Are there other common heart diseases that maybe we've not mentioned?
Not quite, because we categorize them as congenital and acquired. Congenital has a wide range of diseases. Acquired is mainly rheumatic heart disease in children. The rest is not much.
Okay.
Yeah.
One of the signs, I think, when I was reading through this is a child who's not very playful. Sometimes they can be lazy and they can be misunderstood because they may not understand what is going on. What would you say about that, Dr. Ari?
Actually, that is a very interesting and very important point to raise to mothers. When your child cannot cope with exercise and has no fever, we all know, let the children go, they can play a whole day.
Right.
When you find a child who is not quite playful, goes to the field, plays a bit, comes out to rest, that may be a warning sign. An
indication.
Yes. When you see a child who sweats a lot, even when it's so cold, the sweat is just dripping, that could be a sign.
Okay.
When you see a child who breathes pretty fast, has no fever but is really breathing fast, that could be a sign. When you find a child who is not gaining weight, and especially breastfeeding mothers, we know we are saying 6 months of exclusive breastfeeding, but this baby cannot cope with breastfeeding. Will feed a little, gets tired, releases the breast, sleeps a little, wakes up, but the weight gain is also poor. That is also a sign.
Okay.
When you find the color is different, like the tongue on the figures may be a bit fat and looking a different color, that may be a sign.
Okay. Thank you very much. Dr. Chege, let's talk about the MATTR Heart Run. This is going to be taking place this weekend.
Yes.
What do you intend to achieve?
What we intend to achieve, like I told you earlier on, over the years, we've realized there's a need for this cardiac sensitization. So for us, we hope to attain sensitization. At the same time, we want to raise funds, more so for the poor socioeconomic background children who cannot be able to afford this heart operation, these interventions. So that's what we hope to achieve by having the heart run. And it's not just in Nairobi. We are having it in different counties.
Okay.
Yes.
And who qualifies for these funds that are raised?
The people who qualify for that are the poor. And we go out of our way to vet. Along the year, we normally do camps all over the counties. And we actually screen. We go with the doctors and we screen the children. And we discover that they do have these diseases, whether it's rheumatic or even congenital. Then we identify. And it's a poor child. They come onto our program. And we actually take care of them. But we vet. We actually go all the way up to their home to actually see that this is a deserving child who needs to get these funds.
Okay, Dr. Gashara, how important is an initiative like MATTR has taken to come up with just a way of raising funds specifically for those who are financially challenged?
Very, very important. Actually, the children have been helped through MATTR, would have been condemned. Because they are those mothers, even when you look at them, you take history, they'll tell you even last night we didn't feed. So telling them today is the kind of money they will be asked for, it's like, okay, let me go back and wait for death.
Okay.
So children have benefited. And like she said, we are the people who first encounter them. So from the history you can tell this is a very needy child. And it's a child who can be helped through surgery or whichever intervention is going to be done.
All right, Dr. Chege, before I bring in Sophia Lasky, the last question from my end, and this is in regards to details of the MATTR Heart Run. When is it going to be taking place, the times, how much are the t-shirts, so that now we're detailed and we can all come out in big numbers?
Yes. Now, the MATTR Heart Run is going to take place this Saturday, the 23rd. And as I said earlier on, is going to be in various counties. We are going to be in Mombasa, Mombasa Sports Club. We are going to be in Mumias, Buka Academy. We are going to be in Machakos, Kenyatta Stadium. And we are going to be in Nairobi, Nyayo Stadium.
Okay, time is really against us. Yes. How much are the T-shirts?
The T-shirts are 1,000 for an adult and 800 for a child.
Okay.
Yeah, we also have an M-Pesa number, 326-300. You can send in whatever you have. And we hope you're going to come there in large numbers so that we can help these children who really need this. And as we said earlier on, we have about 200 children.
Thank you. All right, let's all rally and come behind this great cause.
Indeed, let us. And where do you register?
You can register at KTN itself, at the MATA, and our satellites, which are all over.
Okay.
Yeah.
What you can do is
Galitos,
yeah.
And also the Nakumats.
Supply to the details and you can tweet them. And so if you're watching this and follow Michael G. Gitonga and Sophia Nuna, you'll get the details later on. Thank you so much for joining us on Morning Express. So our time is up. We must end it there. But also just to thank you for all of your feedback this morning. Always a great pleasure having you on the show. I needed the person of interest earlier. I see quite a number of you continue engaging in as far as the issues that emerged from that particular conversation. But we are out of time, so we'll not be able to sample them all. But just to bring in Michael as we bring this to a close, great show today.
Yes, fantastic. Great interview you had there with Beatrice Alachi.
Yeah.
Good to know, their human side.
I know.
And also, some of the things that they stand for. And she made some very powerful statements here.
I know, she was very open and vocal and
I
clear
love
about...
that she was candid.
She was candid, that's the word, candid about what she felt about some of these very important national issues. So we'll continue to follow them up in our subsequent bulletins. Please stay with KTN. Tomorrow I'll be away from the show, but still working on something that you will be seeing next week on the show. So Michael, I know you will miss me.
Oh, absolutely. But given that you'll be grilling a really nice meal for this family of ours called Morning Express, we'll let you off. But this is where we have to say goodbye and wish you all a fantastic day. Thank you all for keeping us company. Have a good day. Take care of yourselves and
take care of each other. I'll take care of myself. Well, not quite. But yes, we'll see you tomorrow. Oh, he'll see you tomorrow. I'll see you Thursday.
Have a good day.
Bye.